Hello, everybody. My name is Dr. Arnab Gupta. I happen to be a cancer surgeon and also the director of Saroj Gupta Cancer Center and Research Institute, popularly known as Thakurpukur Cancer Hospital. Now, we are going through a very bad phase of life. You all appreciate that because of the corona pandemic. And the kind of profession we are in, where we deal with cancer, which is also a life-threatening disease, unless you diagnose them early and treat them at a very early stage. Now, the problem is, during corona pandemic, the cancer treatment becomes more complicated. You have to select your cases properly. You can't operate on everybody. Even for chemotherapy, you have to be careful. So you have to follow certain guidelines, which we had been doing. In Thakurpukur Cancer Hospital, we had been adequately careful about screening of corona patients. It's a new thing. We never had experience in this. So we always had to follow certain guidelines. We had been sanitizing all the patients who had been entering our premises, may it be staff or the patient or the family, by washing hands and cleaning with hand rub, alcohol rub. We used to check patients with thermal gun as well. When they go to the registration counter, we have measures to make them stand at 3 feet distance, as is being recommended. In the waiting area, we'd been seeing selective cases, not the routine cases, and that too we had been maintaining social distancing. All the staff had been adequately prepared with the masks and hand sanitizers. We had created isolation wards, not only for patients who had leukemia, who are very susceptible to infection. So we had separate wards for children, adolescents and adults. And at the same time, we had a separate ward for people who are possible carriers or suspected case of corona, unless proved otherwise. And the people working on isolation ward, especially in corona suspected cases, they had been provided PPEs. Obviously, initially we had enough struggle to get them, but now fortunately we are having good supply. So we are able to provide the right kind of PPEs which are comfortable, along with N95 masks to our staff. Now, what happened, unfortunately, on 14th of April, Poila Boishakh, we had one patient with lung cancer treated outside a month back, came in with acute respiratory problem, and to save him, we got him admitted. We gave him all the resuscitative measures with which he improved. But unfortunately, when we suspected that this patient could be a COVID carrier because of a history of fever, he was shifted to the ward and we got the COVID testing done and he tested positive. We had tests done for other people as well, but those were all negative, but this one was positive. So as soon as we got to know that, we spoke to the Shastha Bhavan and we got him shifted to the nodal COVID center, and we put the staff who were dealing with this patient as quarantine. So we had about 30 people of the nursing staff, the ward boys and sweepers. They had been put on quarantine. And we have sanitized the ward, and we have been doing phase-wise sanitation anyway throughout the hospital. Now, what happened after this incident? Although we had been doing all sorts of philanthropy, as we do in this hospital, we had been donating blood, which has been a problem recently. Myself and a lot of other staff, even the nursing staff, the blood bank technician, and also a lot of volunteers from outside had been coming to our hospital to donate blood to support the children and other patients who needed blood, especially platelets. So in spite of all that, once we had this diagnosis of one COVID case, what had happened was like a panic attack in all the staff. Of 850 people, most of them got so frightened that 95% of the staff have stopped coming, not only for their own fright, but also the fright that has been created in the neighborhood, wherever these people are staying. The hospital has unfortunately got the bad reputation that it's all COVID contaminated. Just one case doesn't make it a COVID center. It's happening everywhere in the world. The incidents in most of the countries. So one case in a hospital, we might have a few more cases in future because the COVID is still very much there. So because of this fright which has happened in the neighborhood, the people are not allowing the staff to join their duty. Although some of our staff are happy to come back, they are not allowed to come out of the house. If they come out of the house, they are not allowed to go back in again. They are refused services from the shops, which is pathetic. You got to all realize that unless the staff are allowed to work in the health sector, we will not be able to fight corona. We are taking our life risk to save you. So unless you help us serving the community, the hospital will unfortunately close. This hospital was created with a lot of effort by my late father, Dr. Saroj Gupta, for the service to the humanity. We have been doing a lot of philanthropy for people. And the last thing we would want this 310-bedded hospital with all the modern facilities to shut down just because people are frightened. So it's high time that we understand that we have to help the health workers and not really restrain them from working. Because what will happen in future, not only cancer hospital, if even a cardiac center or any multi-special hospital has a few COVID cases, we don't want the hospitals to be shut down, because if somebody has got a heart attack or any emergency, we would not be able to go anywhere. You got to realize this very early. And what I think is more unfortunate is that people don't understand what is primary contact. If you are aware, that's good. But basically, primary contact is when you are in close contact with a COVID confirmed or suspected cases or case for more than 15 minutes within 3 feet distance. That's when there's a chance of getting infected. Even then, it's not that high, but yes, there's a chance. So, people who are in contact with these contacts are hardly going to get infected. So what has happened is most of the people working in this hospital, they are labeled as, infected, COVID infected, and they are supposed to be, people are saying they have to be on quarantine. People are threatening them. They have informed the local police station, but I don't think that's fair. You got to understand, COVID doesn't affect everybody. It's only the people who are in really close contact without proper protection. So these are the people who can get affected. And even then, you got to also understand that COVID can cause minor ailments in 90% of cases, especially young fit people. But yes, in 5% cases it can be critical, especially in elderly who have diabetes and hypertension or cardiac problems. So yeah, these people need to be protected from the healthcare sector. And if you are working in health sector, you have to be away from little children and the elderly people with comorbidities like we do. I've got my mother who's 86 years old. I'm staying away from her. I'm instructing my wife to give the medicine. I'm staying away from my daughter who's 17 years old. I've got another daughter who's staying in US, stuck in her house for more than 3 weeks. So we are all going through different critical phases. But I think we all have to come out of this situation, and the best thing to do is maintain the social distance, help the healthcare workers. And the last thing you should be doing is stand in a mob or a crowd, doing shopping and going to the market on a daily basis just to spend some time because you're in a lockdown phase. That's the worst possible thing that can happen. You don't know how many of them are carriers or are actually infected. So that's the last thing you should be doing. And I hope this hospital, which has been serving the community, should once again start functioning so that we can serve the community once again, the suffering humanity, the cancer patients, especially the poor little children who are at the maximum risk of dying without treatment. So my prayer to all of you, please be with us. I'm sure we can all fight out cancer and fight out COVID as well. My best wishes to all of you. Thank you very much.